All right. Welcome, everyone. This is Cory Strathman with Grace in Your Corner. And today I am privileged and honored to have our special guest, Tim DeWeese. Tim is a worker for Johnson County Mental Health in the Kansas City area. And I brought him in to share his expertise with us. So, Tim, thanks for joining us today.
I appreciate the opportunity to be here with you.
Yeah, so just a little background, what we're doing. As you know, it's Mental Health Awareness Month, and I'm really trying to get as much content and resources and people out just to continue to educate and inform people of what is available for them, because that's a huge step in it. So my goal for this conversation, Tim, is you're the expert. This is your platform. They don't need to hear me talk anymore. They get that all the time. I want you to enlighten us with what's going on in mental health and what we need to be aware of. So with that being said, why don't you just start off by give us a snapshot of your background and your experience in mental health.
Okay. So again, I am the director of Johnson County Mental Health Center, which is a part of the metropolitan Kansas City area. And so we are the community mental health center for Johnson County. So the unique thing about the mental health center here is that we're actually part of county government. So I actually report to the Board of County Commissioners. They're the ones that appoint me. And so it's a little unique in that sense that we're part of county government. Only 2 mental health centers in Kansas are set up that way. Us and Sedgwick County in Wichita. So that's a little bit of a unique situation. I've worked for Johnson County Mental Health Center for almost 24 years, and I've been the director of the Mental Health Center for the last 5. So I feel really fortunate to be able to have worked in an organization, worked in a community, and now I have the opportunity to lead that organization. So I feel very honored and privileged to be afforded that opportunity.
Yeah, that's amazing. And Johnson County Mental Health is lucky to have stability in that position and just that consistency. So that's great. And
thank you.
Before we started recording this, I was talking, and as I started to explore mental health in Kansas City, it seemed like everything that I was looking at, I kept seeing Tim's name pop up. He's a part of this group. He's leading that group. He's leading this charge. So, man, thank you so much for what you're doing for Kansas City and beyond. It's amazing.
Thank you. I appreciate that.
So let's jump into it. Tell me more about Johnson County Mental Health Services. What do you provide? What do you do? What is your mission?
So we serve as the local mental health authority for both the county, and then we are also licensed as a state mental health center, as a community mental health center. And so every community across the nation, not just in Kansas, not just in Johnson County, but every community will have a community mental health center. It just so happens that in Johnson County, Kansas, the county commissioners decided to create a community mental health center that was part of county government. And so our role really is that of a community mental health center, and that is to focus on taking care of the individuals that have the most severe mental illnesses. But it also is important for us to be able to be responsive to our community's needs and to kind of serve what I've described as a gateway to behavioral health services in our community. So if someone needs help, someone doesn't know where to go, then calling us, calling the mental health center, or stopping in at the mental health center is the best thing you can do. We may not end up providing the individual services, but we're going to ensure that we get them connected with the right resources. So we really the front door to mental health services for our community. That really is our mission. That's what we try to focus on, is to let people know that if they just don't know where to turn, call us and we'll get you connected with the right level of care.
Okay, so I'm picking up the phone and I'm not sure. So when in doubt, go ahead and give the call. What's that look like? You guys have a questionnaire that you go through with them, or
yeah? So basically, there's a couple of different situations. We operate a 24-hour, 7-day a week, 365-day a year hotline, and you can call that. That number is 913-268-0156, and you can call that anytime. whether you're in crisis or whether you're just needing a little bit of information about Johnson County Mental Health Center or about how to receive services in Johnson County. And so that service is always available. The other way that you can contact us is that you can go to our website, which is jocogov.org/mental health. And we can walk you through the process of accessing services. What we do is one of the things that was important for me when I became the director is I wanted to make sure that that access was fairly easy. What I've seen historically is that people called and there was, got a little information, and then they were told, well, we'll see you in about a week for an intake. And that's just not acceptable.
Right.
If a person has the courage to call that day, then we need to be able to help them that day. And so what we do is we have an open access model. So that means that anyone can walk in while we're open, and we will assess them and connect them with services that day.
That's amazing. I mean, that is a huge need, in my opinion, in the mental health field. We got people at some of the most severe emergencies in their life, and we're telling them to hold on. It
Right.
doesn't wait. The disease doesn't wait. So I love hearing that right there. So talk to me a little bit about, because when I navigated through, and I feel like this is probably for most people, I had no idea where to start, what to do, insurance and that. When you're talking about insurance, how often does insurance become an issue with people trying to get into you? Is a lack of insurance being a barrier? Are they being turned away? What does that look like?
So it absolutely is an issue across the board. It's not necessarily an issue for us. It's an issue in the system as a whole. And what I mean by that is that there's always going to be access problems with mental health services until we in this country decide that mental health care equals physical health care. And so until we start treating mental health or mental wellness like physical health care, there's probably going to be a difference. And what I mean by that is really it's a parity issue. Most mental health coverage is not in line with physical health care coverage. What I mean by that is if I have diabetes or if I had a heart condition, then I'm going to get a certain level of treatment. But if you have depression or anxiety, it really depends upon what insurance, what carrier, what plan you have. It determines on what type of treatment you're going to get. And what we need to do is really be able to look at mental health issues no different than healthcare issues. So you ought to be able to get the same type of service regardless across the board for whatever illness that you have. And that's really when we start to talk about parity issues, those are important. I think then we also have to talk about just the fact that people don't have insurance. And unfortunately in Kansas, we haven't expanded Medicaid. And so we have a large portion of people that don't have insurance. So that creates a barrier to access as well. The good thing about the Community Mental Health Center is that we won't look at that. The first thing we're going to do is assess what's going on with an individual, and we're going to get them connected with the services that they need. And so our services are based upon ability to pay, meaning that we have a sliding scale fee. We also have a zero fee. So services for us are going to depend upon what level of care that person needs, and we'll get them connected. And then we also have partners that also have those type of sliding scale fees. So it really depends upon the insurance carrier, the type of insurance. And unfortunately, when I talk with people, when I talk to parents, when I talk with individuals, they know about their physical health care insurance. They know what's covered. But when it comes an issue where they need to have mental health care or substance use disorder care, whatever it might be, then that's when they realize, well, they don't have coverage or their coverage is very limited. And so we really need to focus in this country to equal mental health care with physical health care, treat it as such, and insurance and provide insurance and coverage as such. So when we do that, then I think we'll be able to see us actually make a huge impact in the ability for people to access and get care.
Yeah. I mean, I couldn't agree more. It's just, it feels like we're kind of wading through water trying to figure this all out, but we need more people that are as passionate and see the need for this. I mean, this is a huge need. We're dealing with people's lives here, um, and I truly think it comes back to too. We need to educate people. Not enough people are informed and
Absolutely.
educated about the topic, and um, it, truly, I think that you don't really, unfortunately, people don't become familiar with it until it directly impacts them.
Right.
And
I think that goes a long ways to the notion of stigma. I think the reason that we don't necessarily always talk about mental health is because there's a stigma associated with that. I mean, the thing that I compare it to is, 20 years ago, we didn't necessarily talk about cancer the same way we talk about cancer today. 20 years ago, we wouldn't have talked openly about breast cancer, or we wouldn't have talked openly about testicular cancer, or whatever type of cancer that you have. Today, no one gives a second thought to talk about the C word, cancer.
right.
And so we need to begin to talk about mental health disorders in the same way. And until we do that, until we really begin to talk about it, educate the public, and remove that stigma, I think that that hesitance and that unknowing is always going to be there.
Yeah, I mean, I've lived it. I did not want to come out and say that I was dealing with these issues, and a lot of it was for fear of judgment. And it's like, you, it could be way worse if I say something, and that's not necessarily the case, but that's what's going through. It's just that it's an awkward silence because the person that's impacted doesn't want to come out because of fear of judgment, and I feel like the people that are surrounding them might not necessarily know how to approach it either. So we just leave it alone and hope it goes
Right.
away.
Yeah.
Um, couldn't have said it better. But so let's talk a little bit about um, the family, because I went through this, and it wasn't just me that this was taking a toll on. And when I was in my low of lows, uh, it was really wearing down my wife, my
Mhm.
parents, my siblings. What does Johnson County do for families as a whole?
Right. So one of the things that learned early on when I first got into this field, I was as a case manager. Since I was a new case manager, I got assigned to work with. At that time, it was called AMI, the Alliance for the Mentally Ill, and it was there that I began to really begin to see the impact that mental health conditions have, not only on the individual but on their support system and on their families. And so from early in my career, I understood the importance. And so we have constantly always tried to make sure that we involve the families in all aspects of treatment. And then sometimes that's a little more difficult. Sometimes people don't necessarily want their families involved, but that's where we have to have open conversations with them to talk about why it's important that their support system know what's going on. It's important for us to talk about things like HIPAA, and to realize that HIPAA is there to protect the individual, but it doesn't mean that we can't talk with family members. It
Mm,
doesn't mean that we can't support family members or listen to what the family members are telling us or sharing with us. It just simply means that we need to not share detailed information about what's going on with the client that we're specifically serving. And so I think we have to make sure that we find ways that we can support parents, support loved ones, support spouses. And I think that there are definitely ways that we can do that internally with parent and family support groups, and we provide those within Johnson County. We also rely heavily upon our community. And so organizations like NAMI, in Johnson County, we have another families organization called Pathways to Hope. And so we look for those family organizations or those groups that come together and support one another. They're out there, and one of the things that we have to do is find them and then partner with them.
mm. Yeah, and that's what we need. Is we need someone to take us by the hand and just lead us to these groups, because when you're in that state of mind, it's already overwhelming, and then to not know what you're doing is really frustrating. So that's great. You had mentioned earlier your partners, so it sounds like you work really well with other people around Kansas City, other organizations. Who are your partners, and How do they work with you?
So we have all kinds of partners, both within county government, but outside with different providers as well. One of the things that I think that's very important from my perspective as a director of a community mental health center is if we're going to be the front door and if people are going to call us, then we need to be able to have partners that we can refer people to, because we can't serve the entire community. Johnson County has roughly 600,000 people in it. We have 600,000 residents, and there's just no way we could serve everyone. And so one of the things that we have to get out of this mindset is that we're not in competition with one another.
Right.
And so if we move away from this notion of competition to collaboration, then what we can do is make sure that, one, we're not duplicating services, but two, that we're able to make sure that all of us are serving our community in the most efficient, effective way possible. And so we are open to working with whoever wants to work with us in whatever capacity. And so I think it's really beginning to build a culture within your community where human service organizations are not competing with one another. Mm-hmm. Instead, collaborating and finding the best way that they can serve their community. And that, honestly, from my standpoint, is one of the focus areas of the Community Mental Health Center. We are that community mental health center. We are kind of the linchpin in a community. And so we have, in my opinion, the responsibility to kind of make sure that we are that bringing together all of those aspects and bringing together all of those players in a way that we can all serve the community effectively.
Yeah, I love that mindset. I mean, we can't think about them as a customer or a client. We have to think of the life there itself and what can we do to make sure we give the best quality of life for that person.
Absolutely.
That's amazing. So very fortunate if you're in Kansas City, Johnson County mental health. I mean, feels like an abundance, probably not, but it feels like there's a lot of resources. And I say that because I was raised in a very rural county, Nemaha County. A lot of people follow Grace in Your Corner, and they're not as fortunate. They don't have as many resources to go to like this. What is your advice for people in smaller areas, less populated, that might not have all the resources that Kansas City has? Where do they start? What do they do?
Well, like I said earlier, there is absolutely a community mental health center that is assigned to their community. So they may be in the neighboring county, but every community, actually it was late in the 1960s with the Community Mental Health Centers Act, every community in the country has a assigned community mental health center. And so in finding out who your community mental health center is, and then beginning to work with them and beginning to look at how you can support their efforts as a community, but then also that way then they can help support your efforts within your community. I think the other thing is sometimes it's not just about resources. And in my experience, I didn't necessarily, I wasn't raised in an urban area either. And I would argue that sometimes in those rural areas, you may have a few more opportunities because you know everybody. And I think that's where stigma has to be overcome, because when you can really bring together a community to surround and work with the most at risk or the most vulnerable populations in that community, then you're going to succeed. And sometimes that may be even a little easier in a more rural community. But you do have to you do have to overcome that whole issue of stigma.
Yeah, you know what, I actually tend to agree with you on that, just because with Grace in Your Corner, and we're just right at a year today, it seems like back in Nemaha County, things have spread a little bit more with the momentum on it, because everyone does know each other, and they can have these conversations together a little easier. A lot of work to do, but you make a great point that you know everyone.
Right.
But there's two sides to it too. Also, everyone knows what's going on. You don't want to be that person that's signaled out. So you just
it is. It's kind of, it's a double-edged sword, so to speak. And And I think that, there are communities, we are very fortunate here in Johnson County that we have elected officials that understand the importance and are, that are willing to commit tax dollars to that. I think that, again, it's important that you build that community understanding and that community partnership. And there are ways that you can do that in smaller communities. But you're right, it takes some work.
Yeah, but big takeaway there that every community has an assigned center. So identify that center and start publicizing that center to make it known, and that you can start
Absolutely.
making connections. You got to make those relationships. It's everywhere. So that's a great point. So earlier you had talked about addiction. Talk to me about what you see between the relationship of mental illness and addiction. What's the connection that you are typically seeing? Are they hand in hand? Give us some input on that.
They're absolutely, in my opinion, they're hand in hand. And I think often providers of mental health services, providers of substance abuse services, they often at times kind of argue, they go back and forth. Well, this person has a mental health disorder, so they're your responsibility. And then the mental health providers say, no, well, they have a substance abuse problem, so you need to serve them. From my opinion, it doesn't really matter which came first, the chicken or the egg.
Mm-hmm.
The person's struggling and they need help. And what my experience tells me is that in many situations, people are using substances because they're hurting and because there's something going on in their lives that needs to be addressed. And sometimes that can be mental health issues. Sometimes it may not be a mental health issue, but it's a human issue.
Mm-hmm.
So I think that we have to work together and basically provide integrated care. And so you'll hear here at Johnson County Mental Health Center, you'll hear me talk a lot about integrated care. And it means integrated care from not only a physical health standpoint, so we need to make sure that we're physically healthy, we need to make sure that we're mentally healthy. That means that we are mentally well, that we're not utilizing substances to use as coping mechanisms, and that we're living healthy lives. It doesn't do us any good to help someone manage their anxiety when they're also using substances. It equally is important. It doesn't help us to help someone manage their symptoms of schizophrenia and they have hypertension, and they go and they die of a heart attack. So we really need to really integrate care. And the way that we do that is that we make sure that we don't argue about whose responsibility is what. The bottom line is that we come in contact with people who are suffering and who are having behavioral health issues, and we need to find out a way that we can help get them connected with the right resources, the right level of care, and the right type of care, regardless of whether that be anxiety, whether that be an addiction to prescription drugs or illicit drugs. So I think it's just a matter of making sure that we approach this from a integrated perspective, that we're talking about substance abuse, mental health, and physical health care.
Yeah. I again, on my experience of this, I really started off struggling with depression, and then I started to cope. And by the time I hit my rock bottom, I would argue that my addiction had actually overtaken the need of where my depression was at, which is a scary thing. But
and we far too often that's what we see is that there are flags, and I think that's why it's important for like communities to educate themselves. Mental health first aid is a huge opportunity, helping people and providing mental health first aid so that communities know what to look for, so that we can look for those signs that if someone's depressed, that we help them early enough that they don't end up having to rely upon substances to cope, or whether that's anxiety or whatever that might be. But I think that we often see those red flags, and unfortunately, sometimes we don't see them. Other times we just may not be willing to talk about them.
Yeah. And honestly, the question that came to me the most right when I started talking publicly about my life journey is people would ask me, how should I approach this person that I see is struggling that doesn't want to admit it? What do I do? How do I go about it? And that's such a difficult question to answer because everyone's so different. I mean, how do you
Right.
approach that question?
I think the best way to do it is demonstrate that you care about them as a human being. And it may not go well. They may push you away. But the idea is that you're planting seeds, and that every time that you demonstrate that you care for someone, that you tell them that maybe you don't agree with the decisions they're making, but that you would be there when they want help, and maybe be honest and say, we believe that you need help. I think the thing is that showing that compassion, that empathy, and that understanding, not being judgmental, but just being there for them from one human being to another. I think that's the most important thing. You know, my experience is you, as long as you continue to do that, you're providing an opportunity for someone to recover. If you're not doing that, then there's probably very little chance that they're going to just do it on their own. I mean, they may. That's always a possibility. But I've not met very many people that have recovered from any traumatic event or any illness and said, you know, I've done it all on my own.
Yeah. If that's the approach you're going with, it's probably not going to end the way you want it to end, unfortunately.
Right.
So, just a few more questions. Again, we're talking here with Tim DeWeese, and works for Johnson County Mental Health. He's the director there for over the last 5 years. Has worked for Johnson County Mental Health for over 20 years, and a leader in the industry in Kansas City and beyond. So I have to ask you, what's the impact that you've seen from COVID-19 and mental health and your services that you're providing?
So it's really impacted us pretty significantly. You know, we've continued to provide what I would call our routine but essential services. We've had to shift those from doing those face-to-face and in the community to really doing those via technology, kind of like what we're doing today. And so we've had to do that. At the same time, not everybody has access to technology. So we've had to maintain walk-in clinics. We've also had to maintain our medication clinics, things like that. So we're here, we're providing services, we're doing it in a lot of different ways. I think the thing that I think is most important, and you'll see that I'm using a virtual background, and there's something called
I like that, yeah.
Apart, Not Alone. One of the things that we've talked about is that we need to social distance ourselves. And I really don't like the word social distance. What we really need to do is physically distance ourselves from one another, but we need to stay socially connected. We are social, emotional people. We're social, emotional beings. And so we really need to find a way to stay apart from one another, but not alone. We need to stay socially connected. And so the message that we're trying to give to our community is that while we are physically staying apart, let's make sure that we're staying emotionally connected, socially connected, and find ways to do that. And so we're challenging people with this campaign to share with us ways that they're doing that. And a couple of things I think is really important. You know, we've talked a lot about what we need to do to physically take care of ourselves. We need to wash our hands. We need to use hand sanitizer. We need to wear masks. We need to physically distance ourselves. We've talked all of those things about how we can control or mitigate our risks for the virus. We haven't talked about what we need to do to ensure that we're taking care of ourselves and our mental well-being. And so we need to make sure that we're talking to one another, that we're checking on one another, that we're showing each other a little grace and kindness. And I think that, you know, that is something that will go a long way. So I think it's a perfect opportunity for mental health providers to really encourage people to begin to think about what this social isolation is creating. And that's what's happening is a lot of people are socially isolating themselves, and we really need to encourage people not to do that and to find ways to stay connected. If we do that, then I think we will come out of this pandemic better off, and both physically and mentally. So it's impacted us, and I think it's causing us to look at new and different ways of providing services. But I think most important, it's shifted our message to really say, yeah, physically we have to be apart, but let's make sure that we're taking care of one another.
Yeah, and that's one of the first things when all these stay-at-home orders across the country went through that I was concerned about, is all these people that have put in so much hard work. And we know that, especially with substance abuse disorders, that connection is the opposite of addiction. We need that connection. And I actually did a video on it's social distancing, not social isolation. So I'm right there with you. It's
Yep.
You still have to connect with people. You still have to have those relationships to keep you on track. All right, so those were the multiple choice. You got 2 essays, and then you aced this test, all right?
I appreciate it. It's probably the first test I've ever aced.
So, and I think this question really tailors well to you because you've been in the same place, the same area for such a long time.
Mm-hmm.
But talk to me about, like, when you first got in, and even the last 10 years working with mental health in the country, what kind of growth have you seen in the country's approach to that? And then the second part of that is, like, Grace in Your Corner, the people that follow this, what are some actions that people can take to help reduce the stigma that's surrounding mental health?
So I think the first part of that question is, I think there's been a lot of positive movement across our country. In particular, over the last couple of years. Specifically in Kansas, unfortunately, over the last decade, we've seen kind of a slow dismantling of the public mental health system. And so we're slowly kind of in the last couple of years moving back. But I think as we begin to talk as a nation more and more about the importance of mental health, the importance of integrating physical health care and mental health care. And when I say mental health care, I'm talking about that as very broad, both mental health as well as substance abuse services. So making sure that we do that, and I see us moving in that direction. I see funding coming from the federal government to support that, making sure that states support that as well, making sure that communities, that cities see the importance that the important role they can play in community mental health. I think those are the kinds of things that are important, and I begin to see that across our community, and I see that across communities across the nation. As far as what, in regards to Grace in Your Corner, one of the things that I've said before the pandemic happened is that civility has become an endangered. It should be put on the endangered species list. We don't see civility very often anymore, and I think that just the mere name of your organization, we have to begin to find a way to provide grace to people, to give people the benefit of the doubt, to assume positive intent. Stigma is a virus, not unlike COVID-19. It's a virus. But with stigma, we know what the antidote is. The antidote is kindness, compassion, grace, and understanding. And we all have the ability to provide that antidote to one another. And so stigma is a virus that we can eradicate. So we should really work hard to do that. And so I think that you and your organization continue to do what you're doing to provide grace in people's lives, to help spread kindness and hopefulness. And I think that's how we begin to overcome these illnesses and addictions.
Yeah, absolutely. And that's part of the reason that I've tried to share so much of my experiences, that I'm trying to, I guess I might use the word normalize, that it's impacting way more people than you would assume. And it's not, like you said before, it's just another medical issue that we need to address. And I'm trying just to show, hey, you can be vulnerable. You can talk to people about this. It's not the end of the world. That we have to stop with the judgment, the fear. of mental health. So
Yep.
we'll continue to push forward with that, and continuing to educate communities and things like that. And I'm sure you have a lot of resources on your website. People can go there.
Absolutely.
With your guys' permission, I throw some of your links up on my website too, so they can get to navigate.
Yeah, absolutely do that. We also have, we're doing a special podcast right now called It's Okay If You're Not Okay with COVID-19. You can find that on any, your favorite podcast platform. And there's a ton of information about resources specific to COVID-19 that aren't just necessarily associated with Johnson County, but anyone can access those. They can just go to our website. Again, that's jocogov.gov/mental health.
Yep. And for all of the links and resources that Tim and I have talked about today, I'll make sure that I put those below. So if you didn't catch them when we went over them, I'll have all that information below. So, you put your pencil down and let's get ready for Tim's final answer, his final question here. He's on the hot seat.
All right.
So let's just assume it, we're going to take a step back, and we know right now, while you and I are talking, that we have people watching our conversation that are struggling. They're suffering in silence, whether it's substance abuse, whether it's schizophrenia, whether it's depression, anxiety, you name it. But they're overwhelmed and they don't know what to do. Whether they're in New Jersey, Kansas City, Alaska, what do you say to them right now? You're talking directly to them. Tim, what words do you give to those people?
I would say that you're not alone, that there are people that care about you, that are willing to help you, and that you just need to pick up the phone and reach out to someone. Likewise, I think that everyone else that's listening to this, we need to be reaching out to one another. So the biggest thing is that people experience this and experience mental illness, addiction, and it all impacts our lives in some way, every single one of us. And so we need to just ask for help, be willing and open to accept that help. And so the primary message that I would say is that you're not alone.
Yeah. Well put. Man, I tell you what, I appreciate your time. This was more than I ever could have imagined. I can't thank you enough. And again, I just have to say, I've been researching a lot of mental health, listening to a lot of things. It was very obvious, very soon into our conversation, your knowledge is an expertise level. Your passion is there. And I just say Johnson County, Kansas City, and mental health field is so lucky to have an advocate like you. And I hope that becomes contagious and we continue that momentum. So thank you for everything that you're doing. I know at times it can feel overwhelming, but I promise you, you are impacting so many people. So thank you for being at the top of your game on this.
Thank you. I very much appreciate it. And I appreciate the opportunity to talk with you and help you in any way that we can to get the message out. Not only here in Kansas and in Johnson County and Kansas City, Missouri, but across the nation.
That's right. And hey, I got a shout out right here. I got Kansas City in the background in New Jersey, but hey, my Kansas City folk might be watching this, so I have to let them know. But
absolutely.
Thank you so much again.
No problem.
Great day, and we'll be in touch.
All right. Take care.